I'm Carly Backer. This is the head to toe assessment. Here is my name tag. This is Maddie. She is also a student. Do you consent to be in this video?
Yes.
Okay. I'm going to do a 360. Okay. Before I begin, I would wash my hands, gather my supplies. Hi, my name is Carly. I'm going to be your nursing student today. We're going to be doing a head to toe assessment. Can I have your last name and date of birth?
Fronts 9/12/2000.
Okay. Standing here, the patient is sitting. She appears to have good posture. She appears to be well groomed, clean, good hygiene. She's even hair distribution, and she appears to have a calm mood. Her facial expression is calm. Her mood is appropriate for the situation, and she is appropriately dressed for the situation. What is your name?
Madeline.
Where are we at?
Your apartment.
What is the time?
Around 4.
Okay, and then what are we doing here today?
The head to toe assessment.
Okay, and then her speech was clear and articulate, and the patient is alert and oriented ×4. Okay, do you have any pain today, scale 1 to 10?
No, I do not.
Okay, all right, patient stated no pain. I'm gonna go ahead and get your pulse. Actually. Okay, patient's pulse was 62 beats per minute, which is within normal range. It was +2 and it was a regular rhythm. I'm gonna go ahead and assess your breathing now. Okay, the patient's rate of breath was 14 breaths per minute. It was at a depth of about 1 to 2. It is non-labored. She doesn't appear to be using any accessory muscles. I'm going to go ahead and take your blood pressure now. Is there any reason that I can't take your blood pressure on this arm?
No.
Okay, would you mind removing your shirt? Okay, no AV fistulas and no mastectomy?
No.
Okay. Okay, the patient's blood pressure was 120/80, which is within normal range. Okay, I'm gonna go ahead and ask you to puff your cheeks, smile for me, frown. The patient's facial expressions, resting, are symmetrical, and facial movements are symmetrical. Her nose is midline, her eyes line up with the tops of her ears, and eye movement is also symmetrical. I'm gonna go ahead and have you look over my shoulder. I'm just gonna measure your pupils. Pupils are about 6 millimeters both sides so they're equal in size. I'm gonna go ahead and shine this light in your eye. Go ahead and look right past my shoulder. Okay, one more time. I'm gonna be looking at the opposite eye. Alrighty. And then go ahead and follow my pen. Okay, the pupils are equal and round. They are reactive to light, both direct and indirect, and they converge and constrict with accommodation. Next, I am going to go ahead and inspect your arms. Oops. Okay. Okay. Arms are evenly colored. There is no color variation. There are no abnormalities, no deformities. I do not see any lesions, no primary vascular or tertiary, no secondary lesions. I'm going to go ahead and palpate the arms. Do you have any pain or tenderness?
No.
Okay. The patient stated no pain or tenderness. The temperature of her arms was warm and a little bit cooler at the fingertips, which is a normal finding. And there is no edema at this time. I am going to go ahead and move on to your chest, so if you wouldn't mind turning around for me. Okay. Her chest wall, I'm going to go ahead and inspect your chest wall. So the scapula are flat and symmetrical, and the spine is midline and it is straight. I'm going to go ahead and listen for your lung sounds now. Go ahead and take a deep breath in and out every time I move. Okay, and then I'm going to go ahead and end mid-axillary. Okay, all lung sounds were clear and even, and there was no bronchi, no wheezing, and all sounds were cleared bilaterally. If you wouldn't mind, go ahead and turn around for me. I'm going to do the same thing on the front. Okay, go ahead and take a deep breath in and out every time I move. And I'm going to end mid-axillary again. Okay, lung sounds were also clear bilaterally. There was no wheezing and no bronchi. I'm going to go ahead and take a listen to your heart sounds. Okay, first is the aortic, which is the second intercostal space, right side, right sternal border. And then I'm able to hear S2. The next one is pulmonic, which is the left side, left sternal border, and second intercostal space. And I'm also able to hear S2. Next is Erb's point, which is the fifth intercostal space, left side, left sternal border. And I'm not able to hear any murmurs. Next is tricuspid, which is the left side, fifth intercostal space, and it is the left sternal border. And I'm able to hear S1. Next is mitral, fifth intercostal space, left side and midclavicular line. And I am able to hear S1. Okay, all lung sounds were heard as expected across all the fields. I'm going to go ahead and ask you to lay down for me now. And I'm going to use this blanket to cover everything but your abdomen. Sorry, this is a really big blanket. I'm just going to use your jacket actually just to cover everything but your abdomen. I'm going to go ahead and inspect first. So her abdomen has a flat curvature. It is not distended. All four quadrants are symmetrical. Her umbilicus is midline and it is inverted. I do not see any primary vascular, tertiary, or secondary lesions. The hair is evenly distributed. Okay. I'm going to go ahead and take a listen to your bowel sounds now. Do you have any pain or tenderness? Okay, so I'm going to go ahead and start in the right lower quadrant. If she did have any pain or tenderness, I would start one quadrant clockwise, so that I would end in the quadrant with pain. Okay, I heard regular vowel sounds, active vowel sounds at a rate of about 16 per minute, which is within the normal range of 5 to 30 per minute. I'm going to go ahead and palpate now. Go ahead and let me know if you have any pain or tenderness. Any pain or tenderness? Pain or tenderness?
Nope.
Pain or tenderness? And pain or tenderness. Okay, patient stated no pain or tenderness. I'm going to go ahead and inspect your legs now. You can sit up if you'd like. Okay, go ahead and have your feet up here. Okay. All right. There is no color variations on the skin. I do note one primary lesion in the form of a freckle. I note a second one on the other side, also in the form of a freckle. There seems to be even hair distribution. No color variations, no deformities or anything like that. I'm going to go ahead and palpate. Do you have any pain or tenderness?
No.
Okay, and then any numbness or tingling? No. Okay. Patient stated no numbness or tingling and no pain or tenderness. There was no edema at this time. Temperature is warm throughout the leg and a bit colder at the feet, which is a normal finding. I'm going to go ahead and have you point your toes for me and flex them back. Okay, normal dorsi and plantar flexion. I'm going to go ahead and inspect for any breakdown, skin breakdown, or decubitus. Okay, I'm going to peek between your toes. Okay, there are no signs of any skin breakdown or decubitus. And then I'm going to go ahead and palpate your posterior tibial pulse. The posterior tibial pulse is about a +2 and it is a regular rhythm. And I'm going to go ahead and do the dorsalis pedis pulse. It is also a +2 and it is a normal rhythm. The patient does not have any IV, no Foley, and no oxygen. Do you have any other supportive devices? Okay, patient safe, no other devices. I'm going to position the patient for comfort, leave a collet and items within reach, put the bed in the lowest positions, side rail up ×2, and document all my findings.